Hey guys, happy Palayar Chaturthi. We will discuss a delightful one slide education on camphor poisoning. Okay, yeah. So this is a very common poisoning that we see maybe one or two patients in a month, and you need to know what to do. This can also be asked as a short question, breakup of a 5 mark question. So this introduction is for general poisoning. Any question asked on poisoning, you can write the same introduction. The incidence of poisoning is about, at least the reporting is about 36.5%. This is from National Poisoning Center in Delhi. And the age group that is commonly involved is less than 6 years, especially in the accidental poisoning group. See, your poisoning can be accidental or intentional, and 80% of the poisonings are accidental poisonings. 20% is intentional. Intentional generally is older age group, adolescent age group, right? So, what is the pathophysiology behind accidental poisoning? Either you can write for any sort of poisoning question they ask, like as part of your introduction. This will hold true for almost any poison, right? So, in an infection, you tell there is a agent, there is a host, and there is an environment. Similarly, here the host is an exploratory and inquisitive young toddler who is very curious about his or her surroundings, and they like to climb up and they like to pull down things, right? The agent is a poisonous substance. It is within reach. It is in a attractive bottle, or it is in a very day-to-day bottle, like a water bottle. They don't realize that it is something that should not be touched. They think it is water. They open up in the, you know, the proud moment of having, prized open that bottle, right? And they pour it on themselves, right? So that's a bad thing. Both attractiveness is also bad, a regular thing is also bad, and easy to open. So all these things you can put in the agent part. And the environment where the parent is unaware that the substance that they have kept is one, dangerous substance, two, it is easily within reach, and three, they don't monitor the child, especially when they know that something like this is within the reach of their kids. Okay, this gives the perfect setting for an accidental poisoning to happen. So camphor is basically an essential oil that is derived from Cinnamomum camphora. If you can remember, you write this, but most of the camphor nowadays are derived from, or one of the derivatives of your turpentine. Okay, it is colorless. Okay, or if it comes in those small pellet-like things, it's whitish in color. It has got a strong odor and a pungent taste, so you cannot miss a child who has consumed or applied all over themselves. You will definitely smell the smell. So, where is it found? It is found in many of your cold or vaporized preparations. Okay, your Vicks contains around 4%. Your FDA approves less than 11% content. Okay, in all of your commercial products. Okay, so your Vicks, your Tiger Balm, whatever cream you apply for your headache, body ache, that contains about 4%. Okay, topical preparations as part of anesthesia. Some moth repellents have it. Rituals like in Ganesh Puja. Today we would have done Arati Dibharadare, no? So in that also you use camphor, right? So what happens if you consume? It is absorbed by both gut, skin, and through inhalation. Both three. Okay. So through gut, if they take in orally, through skin, if it is rubbed, inhalation. Okay. So less than 11% we already saw. See, there is a little bit of என்ன சொல்றது difference in the mg per kg. Most of the places they have told up to 30 mg per kg, children generally remain asymptomatic. Okay, having said that, especially in these camphor sort of camphor pellets which we use for puja, that is what mostly gets consumed. Right? They are unmarked. You do not know how much grams, percentage, whatever it is there in that particular amount of pellet or tablet, right? So very difficult to quantify. But if you have something that tells that this is the percentage of camphor in it, then up to 30 mg per kg you need not worry. Neurological toxicity can be seen as low as above 30 mg per kg. Above 50 mg per kg they will definitely have. And fatality, most standard textbooks and websites quote 0.5 to 1 gram for pediatric age group as the fatal dose. For an infant, 70 mg per kg, fatal. Okay. So what is the issue? It is basically neurotoxicity. So what it does is it basically deprives your neurons of oxygen by acting on the oxidative pathway. Basically, neurons die of anoxia when they have done autopsy studies. That is what they have seen. Okay, so it causes neurotoxicity. Obviously, no, if it is going to affect neurons, it is neurotoxicity. If there is neurotoxicity, what will you have as symptomatology? You're going to have neurological features, right? And when will that start? It will start within 5 to 20 minutes and it will peak at 90 minutes. This time point is important because it will determine the time of your observation of this particular patient in your ER. T half is 15 hours. So what are the clinical features? Imagine some child is, putting it inside the mouth. So locally there might be some burning sensation, but you will not see any signs. Okay, this will be more of a symptom. Okay, burning sensation will be present. Epigastric pain can be complained, and some vomiting can be present. Neurological symptoms are what we are more worried about because that is a major issue, no, in camphor. So here they can have altered mental status. Seizures is generally what they come with to you. Otherwise, most of them stay home thinking nothing is going to happen. When the child throws a seizure, people panic and they run to the hospital. Okay, so central nervous system features will be basically seizures and altered mental status. You can expand that altered mental status into lethargy, irritability, confusion, delirium, and all that. Peripheral neurological signs will be some amount of twitching, myoclonus, hyperreflexia can be present, fasciculations can be present. So, if this patient is going to come, what is the treatment you're going to do? If it is going to look like the child has absorbed through skin, lot of camphor, applied all over the body sort of thing, then you need to decontaminate. Use soap plus lukewarm water. This lukewarm part is again important. Why is it important? If you use hot water, you are going to dilate all your skin or blood vessels. So if it is going to dilate, lot of absorption is going to happen, which is what you're trying to avoid, right? So always use soap plus lukewarm water. Don't use hot water. No activated charcoal and don't induce emesis. Okay, important. Then you see what the symptoms are. If the patient is asymptomatic, parents are coming and telling, I'm not sure if the child has consumed, or I know the child has consumed, but so far I'm not seeing anything. Then wait for 4 to 6 hours. Observe if the child remains asymptomatic, discharge. If you feel the child has had one seizure within the first 2 hours, then these children are at greater risk. Okay, so you will need to ideally admit them and monitor them. And if they are seizing, what are you supposed to do? You use benzodiazepine. Usually, one maximum 2 doses of benzodiazepine, your seizures will stop. If that is not settling down, then you use a barbiturate. Phenytoin is unlikely to help in situations of these sort of how to tell these sort of seizures. Okay, and hemodialysis is not of much use. Sometimes too much of seizures or too much of neurotoxicity, it can cause depression of ventilation. That time you might have to electively intubate this patient. Occasional renal and hepatic failure can happen. Why? Because it is metabolized by liver and it is excreted by kidney. And most of the symptoms resolve within 24 hours. There are few occasional case reports of persistent neurological dysfunction, but they are very rare. Okay, and you need to refer them in case the patient is having persistent seizure or if you feel the sensorium is dipping too much and this child might need respiratory support. Okay, hope this helps, and I'm sure this will help you to write not just your theory, also manage your patient if a patient is going to come with alleged history of consumption of camphor. Okay, bye bye, all the best.